Hey there, Dr. Todd Cameron here, GP and founder at M3 Health. Today I want to chat to you people with that know that they are ready to make a leadership upgrade and would like to take on a medical director position in one of the relatively new state-funded respiratory clinics. We have one that's up and running in Ascot, Vale, and this is a salaried VRGP position for around about 30 to 40 hours per week. Happy to talk about the range that is included in that. If it sounds right for you, then listen up. COVID has had a huge impact on health systems the world over, but in particular in Australia, it is impacting the ability of general practice to deliver the usual breadth of care, good quality care, and certainly it is impacting the hospital-based health system as well. And probably the group biggest impacted by this has been children, and whilst children that are school age and above have been immunised now, kids that are preschool have not, and so those families are finding it really tough to get the care that frankly they deserve, and we all know that they should be getting better care than what they are. It's been really difficult to be assessed if you have any ERTI symptoms. Doesn't matter if it's typical hay fever or anything else, because of the anxiety around letting COVID into a clinic setting. It has been difficult to get this, and typically you would be pre-screened by telehealth, either video or telephone, which is good, provides some level of assessment, but is not the same as an in-person assessment. Even chronic conditions, COPD and asthma, have been really difficult to have the normal amount of oversight over, and in terms of offering your patients the best quality care, some of that has suffered. And we know that if we do invite people in, it's really a red zone consult, and most practices simply aren't geared for this, be it ventilation, HEPA filtration, or even the PPE that's used. And the risk to the clinic in particular is that if a patient with COVID comes in and that happens to be spread amongst the team, in the admin and support team, if it's synchronous, it's a disaster because you're going to have your service massively interrupted. If it's a GP, you know how this works. You're self-employed. If you don't see patients, you don't get paid, and that could easily happen to you 1, 2, 3, maybe 4 times in a year. So this is a super, super big deal to get right. And the way a lot of practices have addressed this risk is just to say, stop, don't come in, we're not going to see face-to-face respiratory symptoms in the clinic. Of course, there's always a risk of people coming in with asymptomatic or pre-symptomatic COVID anyway, but this has been the policy for a lot. And it has overwhelmed a lot of hospitals, particularly the emergency departments, and having ambulances ramped. It's a super big issue, which is exactly why these state-based respiratory clinics were put together to address this problem. So we're looking for somebody who has leadership experience or thinks they are about to take that leap and take on some leadership responsibility. That includes liaising with the Department of Health, making sure that the processes and protocols in the clinic are up to date and that we meet our funding requirements. That's super important. That would mean having some time with the PHN. We'll walk through exactly what those commitments are, and we'll make sure that you're appropriately remunerated for those. You do need to be a VRGP. A large part of the funding for the role still comes from MBS billings. It is not like a federally funded clinic, and the 19AB exemptions are still appropriate. If we can work with you for 6 months and you have the right skill set, we'd still love to have a chat to you, so this would apply, but it would be a locum use of a 19AB exemption. As I said, the state government are funding these. That means that we still rely on the MBS. We will be billing the MBS and bulk billing everybody, of course, as you'd expect. We do also look after people who don't have Medicare cards, but that is not a high number of patients. The funding is guaranteed until October of 2022. We expect that to be extended. This is a position that we would love to fill ASAP for the right person. Ascot Vale, you probably know if you've watched this, is inner northern. It is right near the racecourse and near the showgrounds, Flemington Racecourse that is. Great suburb and really accessible. There's a tram that stops right out the front. This is a long-standing general practice that has had a fair bit of energy gone into it in terms of improving ventilation with the flow rates of the existing air conditioning and high-grade HEPA filtration in all of the rooms, and a barrier between the patient and the clinician side. 7 days a week is the operation, and we are open from 9 a.m. till 7 p.m. We would love to cover as much of that time as we can with the least number of people, just to do longer shifts, but we can split shifts. Again, if you think you can do some work and you have your own expectations of what an ideal roster looks like, let me know. But it might be as simple as doing 3 days a week, and the other leadership time might be time that you do remotely. It might not be required to be in clinic. In fact, it mostly won't be in clinic. So let's have a bit of a chat about all of that. The ratio of staff: 1 GP, 1 admin, 1 nurse. So you've got really good support in this environment. We've tried to build the clinic so that it is completely zen. So we have automations around a stream deck. We use best practice, really familiar environment. There is foresight pathology out the back that are doing the swabbing. So in most cases, you don't need to do that. You just need to provide a referral for those services to be done. So reminder, it's a salaried position. The background rate for VRGPs that are not the medical director is $130 per hour for weekdays, $170 per hour for weekend, and you retain 10% of the billings. You also get sick leave, annual leave, and you get superannuation on top of this. So when you gross it up, it works out to about $160 to $170 per hour Monday to Friday, and more like $210, $220 per hour in most cases on Saturday and Sunday. The medical director remuneration is on top of that, and we think that that will be around about $1,000 per week. We'll have a chat to you about that if you're the right person. So we know this is going to be a position that is really well remunerated, should give you the type of work that you want to do. If you love seeing patients and you're keen to get back to face, then this is the job for you. So you're going to see there's an application form here that only requires 3 things. You've got to check the box that you're a VRGP. Non-VRGPs are not invited to apply. We'd like your name as it appears on the APRA register. We'd like your best mobile number for a text message, and we'd like your best email so we can organise to have an interview time. Our team will reach out and organise that with you ASAP. If you have any questions, just use the channels here to ask them. If you think this is interesting but not for you, and you know somebody that it is for, please share it. It's built in a shareable format. We'd love to get the right people in there, serve our community, make an impact, and reduce the impact on EDs and GP clinics in the local area. Thanks. I've been Todd Cameron. Bye.